Hello, today I'm being joined by Dr. Ramy, who is from Legacy. Please introduce yourself and tell us a bit more about you and Legacy.
Hi, thank you for having me. So I'm Ramy. I'm a urologist by training. I did a couple of fellowships in male fertility, men's health, sexual medicine. I did an MPH at Harvard. I joined Legacy a year and a half ago as their head of research, and now I'm their chief medical officer. I also have a full-time job as a urologist, male infertility specialist at Case Western Reserve University in Cleveland, Ohio. So I'm doing both at the same time. It's like a hybrid model of industry and medicine. Legacy is a startup company based out of Boston. Basically, it provides at-home, very high-quality semen kits, right? So we also provide all services and products related to male fertility, from a perspective of supplements, freezing sperm, telehealth consultation, life coaching, nutrition support. So anything that has to do with male fertility, education around male fertility, we provide this.
Mm-hmm. And obviously today we're going to be covering a lot about how men can boost fertility, how men can improve sperm, what that matters for fertility and for pregnancies. But before we do, I think one of the key things to note about yourself and the team at Legacy, which is why we love working with you, is the fact that not only do you provide people the option to have high quality testing at home, but there's the support there from medical experts such as yourself to deliver information and next steps, rather than people feeling alone and not knowing what to do with a result if it hasn't been what they wanted.
Exactly. So we see male fertility as a journey, right? So this journey has different building blocks. So you need education, outreach, you need to make people proactive about their health and fertility journey. So we provide them with service, with education, with support, just to make them go through this journey. Because as you know, sometimes this journey is not a walk in the park. Sometimes it's a roller coaster of emotion, of a medical problem, treatment, diagnosis. So we are there for them with the basic semen analysis as a main start point, all the way up to giving them options of management, of diagnosis, and how to steer them towards medical care for fertility.
Mm-hmm. My husband is infertile. He has azoospermia due to Klinefelter syndrome. And the way that he was delivered the news was not good. And it was through a test at a fertility clinic, but they didn't have the support available to give him any more information than that. So it meant weeks of testing afterwards and seeing a urologist to get some answers. So the whole experience would have been totally different if he had had that support available to try and understand why this might have happened and what might be the next step straight away, rather than having all those weeks of darkness.
I think this is the main differentiator of Legacy from the traditional clinical setting, right? With the clinical setting, you have a very limited time. You have so many patients before you, after you. It's more about revenue, right? You need to see X amount of patients to get X amount of revenue for the hospital to be profitable. With Legacy, it's a bit different. It's a startup. It's more personalized. Like you have a personal relationship with the client. Everything is individualized. Like you have a semen analysis. Like we see the client as a one person. There's nothing general or organic, right? Everything is just towards you. The emotional support, the analysis, all the advice we give are just geared toward individualization. So we want to build this rapport, this relationship with clients, because as you said, fertility is a very sensitive issue. It can get into, right? So we need to make sure that clients are educated, aware, informed, and most importantly, supported emotionally, psychologically, and clinically. So it's not one piece or the other, it's the whole big picture on how to get the clients and patient from point A to point B being either options or education or giving them the diagnosis or helping them figure out next steps. So I think it's a holistic approach that differentiates Legacy from other provider or from the traditional clinical settings of hospitals.
Absolutely. So male fertility, obviously a massive topic, but we've got some very interesting questions for you to answer today. The first one is how to boost or improve male fertility, especially in your 30s.
So that's a very good question. So first of all, you need to have a base. You need to start somewhere. You need to see if you belong to a majority of men with normal semen parameter or abnormal semen parameter. So step one is just do a simple sperm test. So with the sperm test, you're gonna figure out volume, concentration, motility, morphology, and you're gonna be able to calculate something called the total motile sperm count, which is basically a number that takes into account both the quality and the quantity of the sperm. This is the best indicator for us physicians to predict fertility. So if this number is more than 20 million, and this number is set by the WHO, if this is more than 20 million, then most likely the couple, or assuming that there's no female factor of fertility, should not have major problem conceiving naturally. If this number is lower than 20 million, then we have different options and different directions that should go from diagnosis to treatment to support. So we have to start off by seeing what's the baseline and going from there. Now, in general, anything that's healthy for your overall body is good for sperm production. So the body function is one system. So if you're living a healthy lifestyle, this is gonna most likely reflect itself on semen production. So if you eat healthy, a lot of green stuff, kale, spinach, no added sugar, no trans fat, no processed food. If you exercise a couple of times per week, 3 to 4 times a week, moderate to high intensity exercise, if you sleep around 7 hours per night, if you're not very stressed out, all of these factors are good for overall health, for well-being, but they're going to translate into good outcomes for semen parameter. So you should think about the body as a whole system that functions all together. So one thing that's good for you is going to be good for other parts, including reproduction and semen production.
Mm-hmm. And what about fertility supplements? You mentioned diet and what you can eat, but obviously there are some things that you can't get from food, or you can't get enough of from food.
Correct.
I know that Legacy have just launched a product range of male fertility supplements. There's a lot of female ones around, but it's great to have something for men. So can you tell us a bit more about those?
So this has been actually a very gray area. So male fertility supplements, the problem with them is we don't have enough data or good level of evidence supporting a specific combination of vitamins and antioxidants. So we know in general that vitamins like vitamin C, vitamin D, vitamin E, antioxidant like carnitine and arginine, folic acid, fish oil, all of these factors are good for sperm. We have few data supporting them, but the real component that has been shown to improve semen concentration and quality is something called CoQ10. So coenzyme Q10 at 300 milligram per day. So we had randomized control trial by giving men placebo versus this CoQ10 at 300 milligram per day. And they showed that men who took the CoQ10 had improved quality and quantity of sperm. This improvement is not going to be major. You're not going to go from you're going to have 30%, 50% improvement. It's going to be in the range of 20%. So the most important part when buying or deciding for a male supplement is to check if they have this CoQ10 at 300 milligram. Like some other supplement on the market, they have CoQ10 at 10 milligram. That's not good, right? So this is the good thing about the Legacy male supplement. It has all the good stuff, vitamin E, vitamin C, L-carnitine, folic acid, but it also has, most importantly, this CoQ10 300 milligram per 2 capsules. So the client would take it, and then we should never forget that the sperm cycle is around 74 days. Yeah. So any intervention that you do today, you're going to have to wait for 3 or 4 months to see any improvement or any effect. So if the clients or patient will start taking the supplement now, they should not test before at least 4 months to see if they had any improvement.
Mm-hmm. But speaking about lifestyle, it's a combined approach, isn't it? People can't just rely on a supplement as well and then eat badly. Like you need to do everything together, don't you, for the best outcome?
Correct. So anything that's not good for you is not going to be good for sperm production. If smoking has been proven to be bad, excessive alcohol consumption, any marijuana, recreational drug is bad. Anything that increases the temperature of the testicle in man is also bad. So patients should think about the testicle. They sit outside of the body for a specific reason because they like cooler temperature compared to the internal body temperature. So hot tub, jacuzzi, sauna, very tight underwear, if they keep their laptops on their laps for extended period of time, this is going to increase the temperature of the testicle. It's going to put pressure, we call it oxidative pressure, on the testicle and sperm production, and this is going to translate into lower numbers. Mm-hmm. So people should be aware of all of these factors because these are adjustable factors. Like people can take a conscious decision that I want to be healthy, I want to eat healthy, I will stop smoking, I will start exercising, I want to make sure that I'm not overheating my testicle. Most likely, all of these factors will help them get better numbers or a good semen parameter. This is only a correlation. Like we don't have a causation relationship. It's only if you do all of these factors, you have a higher percentage, a higher probability of getting good semen parameter compared to people who did not do that.
Yeah. And for readers who want to check out the Legacy male fertility supplements, which are available in the US, you can use the discount code, which is on the screen right now. Head to our link in bio and receive a generous discount. So what can people eat to improve sperm? Fertility smoothies, you've mentioned vegetables and things like that. Are there specific diets that people should follow?
We have studies showing that Mediterranean diet is the best for sperm production. So a lot of vegetables, a lot of green stuff, fruits, olive oil, anything that's not processed, right? Anything that's deep fried, a lot of carbs, processed food, complex fat is bad for sperm. Again, people should not go on this crazy fertility diet. The golden rule is moderation. We have to eat everything in moderation. It's good to treat yourself once or twice a week with like some random sweet or junk food, but this should not be a consistent diet for the week. So when someone is interested in fertility or they trying to conceive, they should start way ahead of the day of their actual trying. So as we said, semen cycle is between 3 to 4 months. So they should start at least 2 sperm cycles before that. So they should start planning, getting healthier, exercising, being aware and conscious about their lifestyle at least 9 months before their actual date to start conceiving.
Thank you. And what about medicines to boost male fertility?
So it all depends on the diagnosis. So once we establish that the semen parameters are abnormal or suboptimal, then we have a whole algorithm of diagnostic workup to try and figure out any correctable cause for male infertility. So this is an algorithm that's set by the American Urological Association or the American Society of Reproductive Medicine. Basically, they will tell us, depending on the numbers. So if you have, let's say, oligospermia, which is few sperm versus azoospermia, no sperm, severe oligospermia, like very few sperm on the semen analysis, then you have different testing to figure it out. So mainly in general, we have to do a testicular ultrasound to measure the testicular size, to make sure you don't have a varicocele, which is the most common correctable cause of male infertility. Varicocele is the dilation of the veins around the testicle. When these veins are dilated, you're going to have more blood pooling around the testicle. It's going to increase the temperature and causing some stress. So we have to identify this varicocele. We also have to do some blood tests to make sure their reproductive hormones are in balance. So testosterone is the main male hormone for sperm production. If you have a low level of testosterone, then you have to figure out why do you have this low level and treat accordingly. So basically the whole diagnostic workup is trying to figure out if there is any surgery, any medication, any supplement that would help improve these numbers. The good thing is, in more than 50% of the cases, we know and we have a cause for this male infertility. Around 40% of the time, this is mostly genetic, epigenetic. We don't have an answer yet. Studies are ongoing. In the future, probably 5 years, 10 years from now, we're going to have more answers regarding male fertility. But for now, we have around a bucket of 40% that we tell the patient, hey, listen, this is mostly genetics. You've inherited these genes from your family, and it's not your fault. You didn't do anything wrong, but this is the way that it is.
Mm-hmm. Or something fluke that's happened at conception, like with Klinefelter syndrome, which isn't genetic, is it? Inherited.
Yeah.
And how long after quitting smoking will sperm improve?
So the golden rule is the 3-month sperm cycle. So any change should be done at least 6 months or 9 months before actually trying to conceive, because you need to give enough time for a new sperm cycle to improve, to decrease the stress, to decrease the oxidative stress. And we have a very good indicator called DNA fragmentation that we actually also provide at Legacy. It tells us the integrity of the DNA of the sperm. So the sperm function is mostly to deliver DNA into the egg. So we have a test called DNA fragmentation index that would look at the DNA strands inside of the sperm head. And we have a number. If this number is high, it means that there is a lot of stress going on with the sperm production, and there might be a cause. One of them is smoking, another is excessive alcohol, a third would be medical condition like varicose veins, low testosterone. So DNA fragmentation test is also another data point in this whole journey of figuring out what's happening with sperm.
Mm-hmm, absolutely. And lots of our readers have asked, how can you test male fertility, which I know you've touched on before when we started, but can you explain a bit more about what happens at Legacy when men are testing themselves, and what the process of that looks like and what they might find from that?
Yeah. So the good thing is, it's a good thing for men versus women, is that fertility testing in men or individual with the testicle, it's a very simple one-time test. You produce a sample, you go online, you get your kit, and then they will deliver it to you. Sometimes there is a courier that will take the sample. Other time you have to drop it at the FedEx. It goes to our labs, which are CELA certified labs in Chicago and San Antonio in Texas, that will do an official reading with quantity and quality of the sperm. And you will end up with a result document that's usable for any physician. So it's not only for your own use, like you have an official document with all the results in it. This is an accurate test. We make sure like we have an internal quality control check every couple of weeks to make sure that these are true results reflecting what's happening inside of the testicle. So once you have this test, then you're gonna know if you belong to the group of men with normal semen parameter and most likely good fertility potential, or abnormal semen parameters, and then you can schedule a complimentary free call with our telehealth team, basically going over the result, like explaining exactly what's the meaning of concentration, volume, motility, why these numbers are low, what could be the reason, and then guiding the clients toward the next step. So we tell them, hey, you need to go to a primary care or a urologist with a male infertility specialty for them to do XYZ test and then figure out what's happening and treat you accordingly.
So thank you for explaining more about that. How long do the results take to get back?
Probably 2 days, most likely 2 days. We have some exception for bad weathers or delay in transport, but 99% of our results are within 2 days.
And what if the result is not good, or what someone hoped for?
So again, the first thing they should do is schedule this free complimentary telehealth to understand more and be educated on the meaning of bad results. 2, they should start the process of figuring out where to go next. So if we believe that this might be an anomaly, most of the time we give them complimentary to test again. So we tell them, hey, look, we feel that there's something wrong, or just one parameter is way off compared to the other parameter. So it might be a good idea to test again. Most likely we give them a free kit. If most of the parameters are low, then there might be a real problem, and then they should see their actual healthcare provider. Most likely they should go to a urologist with the male infertility specialty. He or she will then take it from there and then do all of these tests to figure out really.
I would also say test early, like don't wait. From what everything I've heard from the community and specialists, so many people might wait. If they're a heterosexual couple, for example, might wait a while to test the sperm, and the female may go through lots of testing first, but it's a team sport, isn't it? So worth checking from the beginning.
This is because of the years of this society that we live in. Like it's geared toward, this is a female problem. And this is why most guidelines started out by, let the female go check herself for any abnormality. And then if there's any problem, then we treat her. And they forgot about the male. Actually, 50% of the time, male is responsible for a couple infertility. So these processes should be done in parallel. So men should check themselves in parallel with the female at the same time to make sure that there's no problem in there. And then even if a man is not trying to conceive at this point, and they're young and healthy and active, they can decide to freeze sperm. So this is a very important part, because now we have evidence that sperm parameters are declining overall. We have evidence that if you have advanced paternal age after the age of 45 or 50, you have higher chances of unsuccessful natural pregnancy, lower IVF outcomes, a slightly high risk of diseases such autism, genetic diseases. So someone would say, hey, I want a cheap insurance policy for my true future fertility. And they will test themselves, make sure the numbers are good, and freeze the sample in case they're going to need it in the future. It's ready for them to use. So this goes again into being proactive, about being educated about the whole process.
Absolutely. I think that's great advice. And also, you mentioned sperm DNA fragmentation, and that's something that Legacy can check as part of the testing. Do you see patients or consumers who may have had, maybe having treatment, may have had a cycle or more, and they then want to get the sperm quality tested to see whether the DNA fragmentation, if there is some, might be playing a role in the IVF not working?
Yeah, this is a great question. We are continuously looking for answers, right? Answers that would define the problem. The more data point we have, the better picture we can get for the fertility. So we start off by this traditional semen analysis. It's a more quantitative and qualitative. So we know the quality of the sperm. Does it have good morphology, good motility? Is it swimming the way it should do? Does it have the good numbers? Is the concentration good? And then once this is checked, then you have to go to the functional aspect of the sperm. Is this sperm actually delivering good and healthy DNA into the egg? Might this be the problem on why you're having failed IVF cycles or recurrent miscarriages? So the more data points by doing the DNA fragmentation, the more answer we're going to have to try to explain these events of miscarriages, recurrent pregnancy loss, IVF failures.
Fantastic. Thank you so much for all of your insights today. It's been wonderful to hear from an expert like yourself. So thank you very much, Dr. Ramy, for joining us today.
It was a pleasure. Have a great day. Thank you for having me. It's great to have like these conversations and try to create a momentum of activism for male and couple fertility. So thank you for having me.
Definitely.